Let's talk about something a lot of medical assistants think about quietly, but don't always say out loud: becoming an RN. Whether it's for better pay, more autonomy, or because you've discovered you genuinely love patient care, moving from Massachusetts to Rhode Island is one of the most common career paths in healthcare. And here's the truth: you're far more prepared for nursing school than you think. Point. Here's why this matters. Medical assisting is often described as a stepping stone career, and there's data to back that up. A large portion of MAs say they entered the field to get clinical experience before advancing. And with nursing salaries often double what MAs earn, plus a projected growth rate of around 6% for RNs, it's no surprise so many MAs are asking, "What's my next step?" So let's break this down into a clear, realistic roadmap. First, understand how your MA experience gives you a huge head start. Most nursing students walk into their first semester with zero real-world patient experience. But you've taken vitals, administered injections, handled meds, documented in EHRs, assisted with procedures, and learned how to stay calm when things get chaotic. That means you're already familiar with anatomy, medical terminology, infection control, and communicating with providers. Many MAs say the hardest part of nursing school isn't the clinical work, it's balancing life, time, and expectations. And because you've already worked in a clinical environment, you're not starting from scratch. Your experience is an asset. Own that. Second, choose the nursing path that fits your long-term goals, not someone else's. There are several routes to becoming an RN, and each one has pros and cons. A traditional ADN program usually takes about 2 years and is the fastest route to becoming a registered nurse. A BSN program takes closer to 4 years but opens more doors, especially if you ever want to move into leadership, specialty care, or advanced practice roles. And here's something many MAs don't realize. Some programs give extra points for healthcare experience. Others allow you to test out of certain classes because of prior medical training. Some even offer part-time, hybrid, or night programs designed for working adults. You have options, more than you may have been told. Third, start planning early, especially financially and emotionally. This part is huge. About half of MA to RN students say the biggest challenge wasn't the coursework, it was life outside the classroom. That might be childcare, work hours, or simply exhaustion. Nursing school is intense but not impossible, especially when you approach it with a plan. Break it into steps. Look at prerequisites and knock out 1 or 2 at a time. Talk to your employer. Some clinics offer tuition assistance. Create a support system before you start, not after. Remember, you don't have to quit your job on day 1. Many MAs work part-time during school. Here's the most important thing. Going from MA to RN is not a fantasy. It's a pathway thousands of MAs take every year, and every single one of them started right where you are. Save this if nursing is on your mind, and remind yourself you're not just an MA. You're a future RN in training. You've already done the hardest part. You started. You've got this.